if we could do that. Hi, I'm Roseanne Queen. I am the president of the Scleroderma Association of BC, and I'd like to welcome you to our 37th annual conference. I would like to introduce you to our next presenter, Dr. Brett Thombs. He is a professor in the Faculty of Medicine at McGill University and a senior investigator at the Lady Davis Institute for Medical Research and Jewish General Hospital in Montreal. He's also the founder and director of the Scleroderma Patient-Centered Intervention Network, also known as SPIN, and he is going to give us an update on his work.
Great. Well, thanks, Roseanne. And it's, even though we're across the country, I feel like I'm among friends. I know many of you personally, and I've gotten the chance to meet you. And others of you, have supported our work. So thanks to your group. The video that I saw when we were waiting to come on today was fabulous. So it's wonderful all that you're doing to support scleroderma. And you'll see that your group is one of the groups that supports what we do at SPIN. And hopefully when we go through what we're doing, you'll feel glad that you've done that. So we'll go through today, some of our work. And let me see if I can share the slides here. I have. Okay. Okay, we can see the slides now, Roseanne?
Yes.
Okay, perfect. So we've been around, I don't know when we started, there were rumblings and discussions and planning probably since around 2009 or 2010 to develop what's now SPIN. And essentially we're an international collaboration of people with scleroderma, researchers, clinicians, that we work together to try to improve quality of life for people living with this terrible disease. I mean, and if you think about the basic paradigm of living with a rare disease, and scleroderma is no exception, that the challenges you face are unique and difficult. They're not only difficult because of how terrible the disease is, but just because you're living with a disease that most people don't know what it is, and many healthcare providers haven't helped anybody with the condition, and so it's even difficult to get a diagnosis, to find supports, and so forth. And many things that are available for people if you have, heart disease or rheumatoid arthritis or diabetes. There's all sorts of educational supports or social supports and so forth to deal with your disease and live better every day. And for the most part, particularly when we started this, 10 or 12 years ago, that didn't exist in any rare diseases, and certainly not in scleroderma. Again, and so what kind of programs are we talking about? Things like patient education, anything from education on nutrition to managing pain to whatever you might be facing. Self-management tools. I'll talk about that a little bit more. Self-management is really, it's a bad name. It's something we use in the industry, but it doesn't mean managing by yourself. It means becoming more efficient at kind of becoming your own coordinator of your care, working with healthcare providers, with your doctors, otherwise, learning and being educated and doing the best you can to live every day to the fullest, given the condition you have. Psychological supports, physical rehabilitation, physical and occupational therapy that, often people have needs with scleroderma, but they don't have providers who know what to do or how to help you. So we wanted to see what we could do to address this problem. We started this so people with the disease have the same kind of access to things that people with more common diseases do. Now how we were going to do this, when we started doing this, again, about 10 years ago, we started doing some homework and we looked for other examples in rare diseases, and there are about 7,000 rare diseases out there. Some of them have, 10 or 12 people with the disease. Some of them are, like scleroderma for a rare disease is more common. But we wanted to develop, tests, and disseminate or share free of charge, accessible programs for people to live better with the disease. And the question was how to do that. And we didn't find any examples in any rare diseases where people had actually been doing those things, where they provided some of these programs and with easy access. So we set out, and when I say when we first started, we brought together, we got a little bit of funding from the Canadian Institutes of Health Research, and we brought together a group of probably 25 or 30 people that included people with scleroderma. It included Bob Buzza from British Columbia, who many of you might know. I didn't see Bob here today, but Bob was involved. And Bob was one of the people who said from the beginning, You guys have identified all the challenges people face. When are you going to all get together and work together to do something about it? And that's one of the core tenets of what we did. I mean, it's not in some ways rocket science. We decided that we really had to have robust patient partnerships. So what does SPIN do? We work together with many patient organizations, including yours. We figure we have all got to work together. We decided we had to be international. We had to bring together networks of international clinical centers. No one is big enough to do this on our own. And we had to get a group of people together with scleroderma to help us get information about what kind of problems they're experiencing, what kind of challenges they want to prioritize in terms of addressing them, and how best to address them. So we launched what's called a cohort, and some of you are part of the cohort, where every few months you provide information on some of the challenges you're facing. We use that information in our program development and so forth. And the last thing we did is we realized that if we had to train people at every place around the world to do these things, psychologists, physical therapists, we'd be in trouble. So we went online to deliver programs via the internet. And think about it, things have moved pretty quickly. When we started 10 years ago, this was just online programs. Things like we're doing today weren't done. Everyone gets on a video conference together. So we've evolved and learned over the years. And now our programs, we have online material, but we also meet with people in groups by video conference so that people can have access to trained educators or trained healthcare providers and also their peers to support each other and work through programs in a group environment. And you'll see, I mentioned that one of the things we do is partner with people around the world. And you'll see the Scleroderma Association of BC here in the second row. And we work closely with groups everywhere. I saw Gaetan is here from Quebec, and so Scleroderma Quebec's been involved too. The provinces across Canada. And even Australia. Australia's become a great partner recently. It's tricky to coordinate. There are many, many hours in difference and so forth, but we've been working with Australian groups more recently, quite a bit. And I mentioned that we started to we needed to have people involved. We need to collect lots of data. The problem is that when you collect data from 100 people or 200 people, imagine that, for instance, in the 200 people, there might be 20 men. So it's hard to understand what's going on with men in general in scleroderma, or what some of the patterns are, or there might only be so many people experiencing, with ILD. And so when you look at, you really want to see patterns and how things are affecting people across broad groups. So we really wanted a lot of people. So we've registered people we registered from 47 clinical sites where people, especially scleroderma sites around the world, in 7 countries. Canada, our biggest ones are Canada, the US, France, and then probably UK is the next level, and then Australia, Spain, and Mexico. And some of you are doing this already, as I've mentioned. You registered with your doctor. You go online every 3 months and you provide information. And we're really looking in the transition to moving more measures in and getting into some areas we haven't studied yet before soon. You log on, fill out some measures on your own. It usually takes about 20 minutes or less, depending on which assessments you're doing. And then we use these data to, again, develop priorities and design our tools. What kind of programs have we done? And I'll talk about some of these. But one of the things when we were talking with patients at the beginning of this, one of the things that was clear is that people had many different needs. So there's not just one problem with having scleroderma. We face many different problems. And what we also learned from people is that we needed things that were specific for scleroderma. It's a really unique disease with unique challenges. And we couldn't just bottle up a program for people with rheumatoid arthritis and send it around and it would work. So, I'll talk about some of these programs. We developed our chat program was for mental health during COVID, the beginning stages of COVID. Our SLED program, support group leaders I talk about. We have a program online for hand exercise and hand function. We're launching right now, actually, our new program on self-management, I'll mention. And then we have some other programs that are developing, coping with appearance changes or SPIN coach for walking into a room and looking different than everybody, and how to manage that situation, also how to be comfortable with yourself. And I saw that that kind of goes right in line with the song you were playing at the beginning, that, we're not just our bodies and so forth, but there's a nice tool developed by psychologists in San Diego in the United Kingdom who've worked on that. And then we're working, the bottom row shows things we're working on, but things like, keeping active, and, it's difficult to be active and physically active or exercise with scleroderma, but it's just as important for you as it is for anybody else. Supporting caregivers and education and diet are some other programs we're beginning to work on. That's a tricky one in scleroderma, is nutrition and diet. There's a lot of things out there, and it's not quite sure how good a lot of that advice is. So just to give you some examples, the first large program we did, and some of you might have helped us test this, was a SPIN-HAND program. And this was developed by physios, occupational therapists, doctors who work with rehabilitation, people with scleroderma out of France. And they put together this, the program, and it's available right now. It's done testing. So, excuse me, if you go to the website here at the bottom of the screen, it's our where we share our tools. You can, if you're not already signed up, you can just sign up. I think you just need to give us a name and a email or whatever it might be. And you can go in and use the program. I see there's something in the chat, but I'm not quite good at toggling back and forth. So Roseanne, if there's something in the chat that I should answer now, can you go ahead and interrupt me? If that's okay. I'm not going to try to go into the chat and read things until the end.
Yes.
Okay, thank you. So you'll see, this is an example of in our SPIN-HAND program. If you go in, there's a home page, and I'll just show you a few of the pages, but there's different modules, and each of the modules might be working on your thumb, for grasping and holding objects, working on your fists and flexibility there, finger extensions, and your wrist. And each of these, you pick an area to work on, and you go to the modules, you do it at your own speed. It has, Maggie Larche is a rheumatologist in Hamilton who works with us, who talks a little bit about how to use a toolkit. And Maureen Salve, who some of you know from Ontario, did the patient intervention. And I know that some people out here, I saw Jeannie Tom on, and I think Jeannie's filmed some stuff I know Jeannie's filmed some stuff for our programs. I don't remember which ones, but different people with scleroderma have talked about their experience with different aspects of what we're doing in our programs. And you'll see here that for each of the modules, like the make a fist selection, there's different exercises. There's several different exercises on this one. And then we have different options. If you have mild to moderate impairment or severe impairment, and you can go to different places in the program, and it'll tell you what we mean by that. It'll show you examples of some things you can do with your hands and how to classify yourself as mild to moderate or severe, because we want to give you, we have different exercises depending on how much difficulty you might have doing them or how much flexibility you have. Each one has videos. I should say these videos were actually filmed. Joep Welling is someone you might know is from the Netherlands. He's a very active person with scleroderma. And he traveled to Paris, which is where they developed our colleagues in Luc Mouton and Serge Poirot from Paris, who developed these, worked with Joep, and Joep took the train to Paris and filmed everything and edited them all. They're marvelously done. So the videos on how to do things. Each one has a transcript or instructions for that. And they also have some tips and photos on things, what not to do, how to avoid some common mistakes with each of the programs. And like all of our programs, you can create a goal. Sometimes it's easier to share your goals. If you want to do this 3 times a week, to share a goal with someone close to you, share it with them. They can ask you how you're doing. It's a little bit easier to keep on track sometimes when you're off doing it by yourself. There's some information pages here. And, videos of different people with scleroderma who have talking about the issues they have with their hands, or even trying some of the exercise we use, and get their input on that. So the SPIN-HAND program is something you can go on our website and do. The next program I'll share with you, the SPIN Chat program, some of you might have taken part in. This is not now finished, but it's really critical at the time, and we were able to launch it because of groups like yours who fund some of the stuff we do. Scleroderma groups are small groups of people, but by all those groups I showed you at the beginning pitching in, we're able to do big programs. And this is one of the only one. This is really unique anywhere in the world, But right at the beginning of COVID, remember back in April of 2020, we tracked people's mental health symptoms. People's anxiety was off the charts in scleroderma. It rocketed right up. And so we quickly pulled together a team of people with scleroderma, some experts, and we put together a program, the chat program. So right away, I think within 20 days, we had brought together this team. We developed a program. We got ethics approval at the hospital. We actually got some funding to get it started, thanks to groups like yours. A lot of different people pitched in. And we launched a trial. And we had people with 11 countries who did this. So this was a program that, this chat program, it gave, 3 days a week for 4 weeks. And people went online, and we had a combination of some education and strategies to cope with mental health, anything from staying physically active to managing worry, to weeding out all the information that was coming at us at the beginning that was driving us nuts. And we had a support group. Each section had a little mini support group at the end, and people from around the world. Like I said, there were 11 countries involved, and many of the groups had 4 or 5 countries involved in each, and with other people with scleroderma. So I think that was, this one we published in Lancet Rheumatology, which is one of the top rheumatology journals. It was really a unique example of, people with scleroderma coming together with researchers like myself and healthcare providers, and really supporting each other marvelously during COVID. So this, I think almost 200 people went through the program last year. And related to that, but separately, we're also continuing to track mental health symptoms in COVID. The good news is that I said that the anxiety skyrocketed at the beginning. It came back down over last summer to fairly normal levels, both, all the mental health symptoms, and it stayed pretty stable since then. So I think people are being pretty resilient, learning how to cope. We're going to keep tracking it now, and thanks to all of you who are doing that. I think, as things start, we'll see where things evolve, and hopefully people keep doing as well. And this is again an aggregate. So clearly people are struggling, but overall, people, if you're struggling, we need to make sure you get some help. But overall, people are doing about how they always are. They've learned how to cope with this, and generally. I talked about this. I sometimes forget where my slides are going, where my mouth is going. So they go at different places. But this is the program I was talking about, the SPIN chat program we provided. And one thing that's nice I wanted to show you is this sums it up. There were 162 participants in the trial. And these are all the people that were involved. So one thing that's nice about SPIN, we really do pull people together from around the world. You'll see some well-known, rheumatologist, John Varga from Michigan is there. And there's people with scleroderma throughout that moderated the groups, right? So I'll talk about our SPIN-SSLED program, where we've trained support group leaders. Since we had all these wonderful support group leaders that were already trained, they helped deliver the program. And all our groups were moderated by people with scleroderma. And then the rest of our team here. And it took a lot, to mobilize very quickly. But these were all the people that were involved in presenting this. So that's one thing that, strategically we've tried to go coordinate people around the world. And we're really like a hub for doing that. And that helps us get programs off the ground on a big scale that help a lot of people pretty quickly, which is what we did at the beginning of COVID. And again, thanks to we were able to do that, like I've mentioned, thanks to your organization and other groups around the world who pitched in. Everyone pitches in a little bit, and we can get it done. The next program I'll share with you that we're working on, again, is possible because of all the funding we get from all the different groups. The bulk of our funding, by the way, is from the Canadian Institutes of Health Research. They pay for research, but it doesn't cover us to develop our programs, and it doesn't pay for us to provide the programs on an ongoing basis after the research is done. So that's where groups like yours come in to play and have such an important role. So right now, we're starting our SPIN-SELF program. You might have seen on social media in that we're just launching it. When we're finished, it'll be available to the public also, but right now it's in a trial. And self-management programs, like I said earlier, really kind of help people get the skills and information they need to be better copers on their own, to use their healthcare providers better than maybe you are right now, to get their advice and figure out what advice, what you need. It's again, is based on modules. So the self-management program has all sorts of different modules that have information, strategies, tips about when you really need help or maybe medication, and when you can do, there's some things you can do on your own. And the categories, there are mini modules on different areas. Again, coping with appearance changes, digestion and nutrition, emotions and stress, fatigue, itch, sleep, skincare and pain. And then we have one that's just dedicated to working with your healthcare professional. Some healthcare professionals are better with than others at really doing, shared decision-making, working with you to figure out what's most important to you, and then making sure that what they're suggesting matches your values. But this can help you make sure that you get what you need there too. Again, Maureen is on this one. She's not on all of them, I promise. It's just the two I've shown you. She was. Laura Hummers is a physician from Johns Hopkins that helped us develop a lot of the material, along with Fred Wigley, who's a marvelous scleroderma doc down there. Provide some information about this. And you start the program with a little quiz, helps you prioritize what's most important to you, the different areas that they're problematic, and then it points you in the direction of which modules you might want to do first. And you can do any modules you want. But the module, again, these are just some examples. There's digestion system and nutrition information. There's some videos and animations in each of these. Dealing with healthcare professionals, managing pain or emotions and stress. And so there's videos there, there's text, animation to help you engage and hopefully adopt some new strategies. Again, just like in our other one I showed you, there's a way to create goals and share goals with other people. And there's worksheets. Sometimes it's really helpful, and we teach how to use these strategies, but managing worry, for instance, there's some nice worksheets on tracking what you're doing for that, pacing your activity for managing your fatigue, preparing, some worksheets on preparing to go meet with your doctors. So you not only know what you want to talk about, but how you want to talk about it, and what your goals are, and figuring out what's most important to you. And again, there's a number of patient stories here, and there's Jeannie. I see Jeannie. I knew you were on one of these. I couldn't figure out which one it was. So there it is. Again, discussing some of their experiences with the topics of the program. The next program I'll talk about quickly that we're running is an ongoing program. It's the SPIN-SLED, or Scleroderma Support Group Leader Education Program. And we just finished a trial, but the training is ongoing. So this one is another example. We build a program over we spent 6 or 8 years, talking to people who are support group leaders, people who participate in support groups, and people who don't want to participate in support groups, to figure out why not. We did large surveys that some of you might have participated in about those things. We got information everywhere we could. We developed this program. And, like I said, the trial just finished. It was a marvelously successful trial. It had great benefits for people in the program. We're writing the reports up now to publish it. But again, the training is ongoing. So if any of you are interested in working with your organization in BC about doing a support group, or if you're interested in doing an online support group, there's real gaps that many people across the country don't access because they live far away from city centers. There's niches too. There's support groups for men and support groups for young people. And we'd be happy to facilitate you doing those online. But the goals of the program are really to help people, increase their skills and confidence and efficacy for doing the jobs they do as support group leaders, which are so important, and reducing the burden on them. And if you think about this model here, support groups have a really key role in scleroderma. But the models that people with a really bad disease, who sometimes get pretty sick, are charged without much training usually with supporting lots of other people who have a really bad disease and sometimes get really sick and have really difficult challenges. So it's really an attribute to those who do this, that they can even do what they do. It's a really tough job. And we're just hoping that we can help people with all the work we've done and build up to have a little bit more education and be a little bit more capable of doing the things they want to do successfully with less burden on you when you're doing it, right? To reduce some of the stress and burden in doing the program. It's a 13 weeks program. So each group meets once a week for 60 to 90 minutes, all over a video conference. Again, like all of our projects, this was put together with a group of people with scleroderma. They helped us to build the program and to monitor it. And by the way, if you're interested, about a year ago, we went out and we asked for people who are interested in being involved in every single project we start, whether it be oral health or nutrition like we're doing now. We pulled together a group of 6 to 10 people with scleroderma to really be part of the research team. And it doesn't take a lot of work. we bring you together and have a meeting. We describe the project and that we're working on. We ask you to help us understand and make sure that we know what the key components of the problem are. Again, whether it be oral health or nutrition or support groups, whatever it is. And then we go out and design a project that tries to address what we know from the evidence and the literature and what you've told us. We bring it back and show it to you, get your comments. So it's really like an expert. You're becoming, living with the disease, you're an expert and you inform us as experts. So if you're interested in doing that, I mean, my contact information is out there and Roseanne and Michelle have it. But just send me an email. We always love to have people get involved, and more people that we haven't worked with before. This is led by, some of you know, you've taken the program. Laura Dias is just a really skilled clinical social worker from Michigan. So she does the training in English. Violet Conrad does these in French in Quebec. And I won't spend too much time, but they go through things like what is the role of a leader and what it isn't, how to start a support group and logistics, structuring your meetings, some basics about scleroderma, getting a successful support group culture in, managing some difficult group dynamics sometimes. And grief and loss was, when we first started this, we did a feasibility trial. We ran this a little bit, and what feedback we got is we needed more on this. So we expanded this into 2 modules. But one is about, your own grief and loss and living with the disease as a support group leader. And the next one is supporting members and coping with their grief and their loss and doing this. And then we have other modules on advertising and recruitment and keeping the group, keeping it alive and keeping it going once you start it. Group continuity, supporting yourself as a leader, remote support groups. So when we started the program, there was only an idea we had that we would, do things like this by video so that people could access them if they live far away. Or now it's really what everyone's doing. So we help structure that and help organize that. Some platforms you can use and other resources. And we have a whole resource library. Getting people to speak in education as part of your support groups is tricky. So we pulled together a big library in French and English of different experts around the world. So we have all their videos there. So if you don't have a speaker, someone can come, you have some resources of things that your group can use. We have a really nice program manual for people to do the program and slides and so forth. And you'll see at the bottom left, what we did is, and a lot of people people with scleroderma came to Montreal, and we shot videos for some of the vignettes and what happens in groups so that you can talk about them in discussions. And of course, at the end, there's a nice certificate of completion. Yeah, when you finish the program. And finally, the last thing I'll talk about is where can you access these things after they're done in research? Well, the SPIN-SLED program is just for support group leaders. So you just talk to Roseanne or Michelle, and they can be in touch with us. So we train support group leaders who are affiliated with an organization like yours, right? Because everyone's going to need that ongoing support. So if you're interested in that, talk to them and they'll be in touch with us. But the rest of the programs we put up on our website, we're calling our SPIN Share platform. This is when we've done the research and we share these free of charge. So you can log in and get these. Right now, the hand function program is up there already. The self-management program will be up there hopefully within the next year or so once we finish our trial. And then other programs will go online as we finish them, and you can go online and pick and use whichever you want, however you want to use them. Again, it's easy to register. You sign up and just email address, where you live, what your role is, some basic information to set up an account, password, and you're online. And I know I'm going through these really quickly, but I can make these slides available. Hopefully, or Michelle, I think you have them already. I sent earlier. You can make them available to people somehow, if to get this information. And again, you'll see a lot of same players, but we really depend on this. So the reason we can provide these things on an ongoing basis, I'm pretty technologically naive, and I thought we just finished these things and put them online and then they'd be there. But I've learned over the years, you do have to have the platform sophistication changes, and we have to have the tech guys, people working on these ongoing. So the funding we get from all these groups helps us to be able to do that. And again, to provide everything in good shape and keep it up to date technologically and so forth. And many of you already follow us, but if you want news on what we're doing and any new opportunities to either participate in research or use programs that we've developed that are ready, you can go to our website at spinsclero.com or follow us on Facebook or Twitter. which I thought was called Tweeter until a couple of years ago when I went into the office of all the young people on our team and said, I really think we need a Tweeter account to get information out. And they thought that was cute. So it is a Twitter account for sure. And that's all I have. I hope we have a little bit of time still for some conversation. I'd love to. I think there's people in the chat. I can let's see questions. Just some comments there. So I'd love, Roseanne, do we have time for some questions or comments from people in the group?
Yeah, it's Patrick here. I'm sort of collecting all the questions on that, but we've only got one question right now on that. And the one question is basically like, why did you actually decide to get involved in this, in scleroderma specifically?
Oh, thanks for asking that. It's a good question. So when I came here to Canada, I was recruited as a researcher, and then I'd worked in burn injuries at Johns Hopkins when I was doing my postdoctoral fellowship. And it's very different, having a serious burn injury versus scleroderma. But I'm a psychologist by training, and many of the issues that people are facing are very similar. The appearance changes, the problems that come with skin from burns or skin from scleroderma are similar. Some metabolic change and fatigue. So there are a lot of similar issues. And I was in a meeting and making some comments on something, and I think Marie Hudson asked me at some point, who I barely knew at the time, would you be willing to do some work with us in scleroderma? I said, sure. I can. I knew what scleroderma was, and I thought I'd sit with them. And one of the things actually, when I first started doing this, apart from I thought I knew something about it and could offer something, is I was exposed very quickly to some of the patient groups and the patient involvement. And I have to say, one thing I can tell you is you're really part of a unique and very special community. And I think that drew me to it very quickly, that, there are lots of rare diseases out there and they're not doing this kind of stuff, not just SPIN, but other ways. But scleroderma is really unique. People with the disease are involved. They're advocating for themselves despite all the challenges they have, and despite not being a lot of you. You're banded together. You have strong groups. And I was really motivated by that. I thought this is a place where we really make a difference, which I think when you get into a field like I'm doing, you really want to do. Lots of research goes on and people publish papers, but this seemed like an opportunity that we could do something that we could actually work with people with the condition and do things that actually change people's lives. And I think that's really the motivation. It's not the only research I do. I do some work in some other areas too. But to put in perspective, we were starting SPIN. Now our feet are on the ground, and we're going to be here for a long time. And we've reached a lot of our goals. And we have a lot of goals still out there. But at the beginning, when you launch a big group like this, it's pretty fragile. It could, I think, fall down at any minute, not get back up. And this way, it used to keep me awake at night, because I've gotten to know a lot of you out there, and as friends now, and people contribute a lot to it. And I used to think, oh my God, what if we don't get this off the ground? What if we don't keep this going? So they used to really keep me up. But anyway, I think now what motivates me is just, being part of this community and knowing so many people. I put the slides up there of people with the disease that contribute to our groups. And a lot of them are friends now and great collaborators. And I really enjoy that. It's really a nice, fun area to work in, an area that I think we're doing things that are helping people and are really successful doing that. And so we have a commitment to doing that. And I'm probably going on and on and on, but that's kind of how I got into it, and why I keep going into it, and why I'll keep doing this until I retire. I by the way, I'm not that old as I may look, but we have a new house here. We're in a beautiful part of Quebec. So Gaetana knows this. We're up in La Macasa, and had a guy come yesterday, the first day we're here, to do some work. And I'm to put it in perspective, I'm much younger than I could be to retire in any place in the world. But he said, "Oh, you have a new house up here. You must be retired." But no. So anyway, but I will be doing this until I retire, because I love it. But I'm not close to being retired yet, despite any news to the contrary.
Well, thank you, and I think we're all happy that you did get yourself involved in here to get this whole process underway. It looks like there's obviously a lot of information that you presented, and everybody's going and says, I think I need to go on with the website and check it all out. And so not too many other questions available here on that. Does anybody have any other questions? Like if you have any, just you can also raise your hand on the Zoom here, but on the chat system.
Is there a really good, do you have a suggestion of a good starting point on the website? Because there are so many different programs. Is there a particular program you would recommend people starting at, or is it really kind of based on your own preference for how you learn?
Well, right now, the only one that's on the website is the hand program. That's the one that's up there to do on your own. But if you're looking for a general nice, coping with scleroderma, our self-management program, which is now we're doing as a trial, starting literally right now, we're signing people up. Get in touch with us, go on our, either through Facebook or Twitter or on our website. You can sign up for the SPIN-SELF program. And that's a really nice all around program that it involves 8 meetings. I think it's over 12 weeks. We don't meet every week, but it involves 8 meetings. And what we do is you sign up and you let us know what days and times you can do it. And then we find groups of about 8 people around the world who can meet at those same days and times. And we bring you together, and they're led by someone with scleroderma who's actually been through the SPIN-SLED program, the leader program. We've done some training with them so they understand not only leading the group, but some of the goals in the self-management program. And so, yeah, that the SPIN-SELF program, which we're clearly promoting because we're starting a trial of it. But I think it's a nice, really, really well done, well-rounded program that addresses many different problems with scleroderma.
Okay. We do have a hands up here. Sidi Manachi, if you want to, you unmuted yourself. Okay, go ahead.
Thank you so much. Thank you, Dr. Thombs, for sharing all your knowledge and experiences with us. In my experience, unfortunately, the Canadian medical system doesn't have much preventative, measures. They all wait until the, issue, the disease or problem progress, and then they want to treat it. Do you do any kind of advocacy work regarding the preventative measures, things like that for the medical system?
Tell me more what you mean. Do you mean preventing like scleroderma from progressing, or do you mean, what kind of prevention do you mean?
Yes, for example, mine is a very moderate and I've been suffering greatly, and absolutely I'm not getting the help I need. My experience is very low quality, and also I haven't found any gastrologist to deal with my very poor digestive system, and it's getting worse and worse. I feel like they're going to wait until the last minute when my whole digestive system fails, and then they want to do something to treat it. You know what I mean?
Yeah, no, this is frustrating. I'm afraid I don't have a great answer for you.
If I can just step in, maybe the thing to do is contact me directly, and I can put you in touch with the scleroderma clinic, and we can sort of help you out that way.
Thank you, Rosa.
You're welcome.
Thank you.
Yeah, thanks, Roseanne. I think that's the best you can do is get involved. If you're not there already, yeah, there's a specialty clinic in Vancouver, which I think is what you're talking about, who can help hopefully steer you in the right direction.
Okay.
One of the difficulties, which all of you know, is that there aren't great preventative measures in scleroderma use. I mean, there's a lot. I think there's a lot more research that's happening now than there ever has been. It's gearing up, but they don't have the same kind of recipes for treatment that they do in many other diseases yet, unfortunately.
Okay, and are there any other questions anyone has? Doesn't sound like it. So I guess we'll go back to you, Roseanne.
So Brett, I'd really like to thank you for everything that you do, not just in BC, but across Canada. And I would really suggest that people go to that website. I do the hand, if you didn't see my note in the chat, I do the hand exercises every day while watching TV. And it's simple, and I really like the don't do it this way. and they're pretty easy to follow. And yes, there's lots of information on it, but on the website, but I do think it's worth just going through it. And if you need any help, I'm sure Brett's staff would be really happy to help anybody out. So thank you very much again. And we look forward to supporting you in the future.
No, thanks, Roseanne, and thanks to all of you. And listen, if you have any questions, my email is easily found. I mean, you feel free to contact me too. I mean, I really mean it that, as you get older, you get busy, but also at the same time, one of the things I enjoy most about this is being in touch with people living with the disease. And I don't want to have only my staff having that opportunity. I'm going to keep a little bit for myself. So don't be afraid to get in touch. Please feel free to. And thanks a ton again for all you do to support the scleroderma community. What we do, what some of your doctors do, and the research that's going on, and all the support that your group provides to people on their own, it does so wonderfully. So thanks to all of you for all of your efforts in that. It's wonderful. And have a great rest of the afternoon.
Thank you.
Or morning, I guess it is out there, isn't it?
It's coming up to afternoon soon.
Okay. Well, thanks for having me, and thanks again, Roseanne, and thanks for all your support, everybody.